Hello and welcome to the Motherhood Village podcast. I have a very special guest on, Kat or Kathleen?
Kat, yeah.
Kat Vigo,
Thank you for asking.
the founder of Painless Pregnancy, earned her bachelor's from the University of Florida in health sciences in 2005 and her doctorate of physical therapy in 2018. She worked in the hospital setting for the first...
2008.
I know, I was like 2018. 2008.
That was like yesterday.
She worked in the hospital setting for the first decade of her career, specializing in everything from orthopedic, neurological, and complex medical cases. But her love for the obstetrician population,
Obstetrics.
there we
Yeah,
go,
there you go.
began when she had her first baby in 2012. Welcome, Kat. How are you today?
Thank you so much for that. I am amazing. I
Yes.
appreciate that warm welcome.
Yes. So before we actually dive into all things of kind of like a little bit of your background and why you kind of fell in love with birth and helping moms, I personally know Kat and know of Kat and the work that she does, but we'll dive into of explaining to my listeners and all that you do. I always love to ask my guests to tell me their favorite book and or anything that has made a great impact, just because I think it's so important and for moms to know. So any resources that helped you, or even now that you've been supporting moms, any book for a mom listening to this that you feel you should recommend to them?
That is a great question. I love that you ask your guests this question. I will share what I'm going through right now. I'm almost done with it. It's Lewis Howes, his book, How to Live Your Best Life Now.
Okay.
It's so fascinating, Nicole. He goes through this really detailed process. Like, you need a notebook to go through this. You're journaling the whole time. And he helps you process different aspects of trauma, which is fascinating to me because we do a lot of trauma healing and releasing from the tissues in the work that we do. So I would recommend that right now.
Awesome. Thank you.
Yeah.
Okay. Maybe share a little bit of your personal experience. I just read from your bio that you really kind of fell in love with the goodness gracious, obstetric population after having your first child in 2012. So maybe share some personal experiences, challenges that you faced, and why you kind of pivoted with your own birth journey that you had and specialized in perinatal and postpartum and all the things birth, or, and the physical therapy aspect of it.
Right. Yeah. So when I started physical therapy as a clinician, I was obsessed with pediatrics. And so when I got my first job, it was split half pediatrics, half adults. Really, they just needed help in the adult world. And I didn't know I would like it, but I did. I fell in love with all things orthopedics. I love putting my hands on people's bodies, moving their joints and making them feel better, helping them feel better. Obstetric physical therapy was not a thing. So I got into this 11 years ago now. My boy just turned 12. And when I had him, there was very little knowledge of anything pelvic floor or preparing for delivery, any of that. I went in with, stories my mom told me and my older sister who had had a C-section.
Sure.
My doctor chose to induce me at 39 weeks, really with no other reason other than my son was measuring large. I had a long labor, and I ended up with a 4th-degree tear and a 7-pound baby.
Oh, wow.
That's not a big baby.
Yeah.
He was tiny, and it was adorable.
Okay, yes.
But he could have cooked for another week. I could have pushed him out naturally. It was just intervention after intervention. Yeah. And so I didn't understand the rehab process that I personally went through. I had no guidance. I had a lot of pain. I had a lot of dysfunction.
You're talking about after or during?
After I had birth. Yeah, after I gave birth, I was left to recover on my own. It was really like, here's a bottle of colon or, stool softeners and drink lots of water and don't push when you poop. I was like, great.
Yes.
And picture this, Nicole. I'm 27 years old, really like in exceptional shape, had no issues with my pregnancy, and I'm being sent home, being torn from front to back. Yeah. Like no control. It was horrific. And then the thought that comes into all of our heads when we go through something, is this forever? Yeah. Like, how am I going to go into a hospital room and help a gentleman who just got both of his knees replaced up out of bed 12 hours after surgery, which is what we were doing.
Yeah,
like, it was massively physical, my job. And I didn't want to smell like I just came out of a nursing home either. Like, it was horrifying.
Sure.
So about a year later, a friend of mine from PT school said, I'm interested in obstetric physical therapy. Let's go to this course. And I was kind of like, okay, sure. Sounds like fun. We'll all hang out and we'll do this thing.
Yeah.
And the teacher from that course, I wish I remembered her name. She was so phenomenal. And she spoke from a place of like, I am working with these pregnant women and they are left in the dust. Mm-hmm. They have really straightforward back pain, rib cage issues, hip stuff, pelvic. Straightforward, Nicole. Mm-hmm. And they go untreated for so long. And then when it's deplorable and they can't walk, the doctors will shrug and be like, all right, well, I guess you can try physical therapy because this lady told me she might be able to help you.
Sure.
And then they get in the clinic and they're like 4 sessions later, they can walk straight and they're stronger and more aligned. And it's like, that is first line of defense. If you go to an adult primary care physician and you say, I have back pain, it's anti-inflammatories and physical therapy.
Yes.
That is the standard of care.
Yeah.
Until there's a baby in your belly.
Yes.
And then they're like, oh, there's nothing you can do.
I know.
So that was just the start of understanding that this was not only my new specialty, but this was a mission.
Sure.
This was like, ladies and gentlemen, pay attention. Mm-hmm. When you get pregnant, you need to do strengthening, stretching. Yeah. And it's...
Yeah, and let me ask, because there's so much to unpack there, and obviously you have a personal experience with it because you're like, wait a minute, I don't want any other woman to experience what I experienced to, and to your point, being in exceptional health, 27 years old, geez, Louise. Yeah, like you can recover quick, but at the end of the day, you're left with XYZ. And I think so much in our society, we normalize like, oh, okay, if you have a baby, like you may leak and you may do this and this. Explain before, actually I asked that question because you have some props here. I want you to explain first for those that don't know how important the pelvic floor is and what is it. A lot of people don't know that. And I think that's where we need to start with the education aspect. So maybe explain and show what is the pelvic floor and why it's so important to your point of strengthening and all of that before, I would imagine you want to get pregnant, during pregnancy, and then after.
Absolutely. Yeah, I love that question. Okay, so what is the pelvic floor? It is a group of muscles that exist at the base of your pelvis. So if you're sitting right now, put your hands underneath your bum, and you should feel 2 deep sit bones. So like if you actually sit on your hands, you'll feel those bones that go deep in your bottom. Okay, those are your ischial tuberosities. Okay. But those are just your butt bones. Okay. Your pubic symphysis, the lowest part of your pelvis in the front, that is another attachment point. Your sit bones are an attachment point, and your tailbone. So all of those 4 bones house these almost like triangular or sling-shaped muscles, and they have a few different functions. They are sphincteric, so they are circular muscles that hold things in, urine, gas, and bowel. They are supportive. They're supposed to keep your organs inside your body and not let them fall out. They are structural, so they add to the integrity or the position of your bones down here. They're sexual, so they need to do certain functions for intercourse to happen or for any other sexual function to occur. And they also have a role in what we call the sump pump. So they help with moving fluid. They help with managing the pressure intra-abdominal and pelvically. So, yeah, they're really important.
Yeah, and to your point, like you said, and then once you're pregnant and about to give life, and your pelvic floor and that region goes through so much trauma in itself, figure it out. Yeah. So we're going to say it's so important to do strengthening. So maybe explain to my listeners what are some things that they should be doing if they're maybe thinking about becoming pregnant, during pregnancy, and then of course postpartum, and to kind of get away from that normalization that, oh, well, I might, leak a little bit here, or whatever the things are that we hear in society that are normal and they're not. Why don't you explain to my listeners those kind of 3 components and ways that moms or things that moms should do to strengthen the pelvic floor and prepare for birth and after?
Yeah. Yep. I love that. So as far as maintaining health in your pelvic floor, we do encourage moms to both strengthen and relax. And then we also need to be able to bear down with those pelvic floor muscles. That's a function of them. It's super important for, having a bowel movement and having a baby. So essentially, if you want to connect to your pelvic floor, the first thing we need to be able to do is to bring your awareness down to that space.
Okay.
This is just like, as a baseline, so fascinating to me, Nicole, because a lot of us will disconnect from it.
Yes.
And so if you can't find that muscle, I can't tell you how many times I've done an intravaginal exam and said, okay, lift my finger like you're trying to stop from passing gas.
Sure.
And they'll be like, I don't know, am I doing it? Like, what? Is anything happening
yeah.
down there? So that's not really a common thing, right? If I say shrug your shoulders, you wouldn't be like, I don't know, am I shrugging my shoulders?
Sure, it's like, it's natural. It happens.
Right. Curl your toes. Can you curl your toes without looking at them?
Yes.
You can.
Yeah.
You're connected to your toes. So that's step one. We have to be able to connect to it. It's nothing fancy. It's literally bring your awareness to there, or maybe if you're sitting, feel that space that would touch a bike seat.
Sure.
And just think about it.
Okay.
Just be in that space.
Sure.
Okay. So that's step one. A lot of us want to know how to contract your pelvic floor properly. So there's a ton of different cues. And there's been actually a decent amount of research. One of my mentors, Diane Lee, I've taken a lot of her courses. She's amazing. She actually studied with like measuring muscle activity electrically, which cue gives you the best recruitment of those muscle fibers in your pelvic floor. Because it really is all about helping people, I don't contract your muscles, you contract your muscles.
Sure.
So the one that had the best efficacy was, imagine you're trying to pull up and in like you don't want to pass gas. So that recruits the back part, right? That's more towards your rectum. But this whole sling of muscles is very well connected. So I like to tell my patients, because I don't want to have them only focus on the back. And again, there's like, if I find a specific situation going on in a woman, I will tailor her cues accordingly. But if we're talking about in general, contracting your pelvic floor, I would say once you have your awareness down there, pull up and in like you're trying to not pass gas, and then zip forward like you're trying to not pass urine.
Okay.
So that cue gets a lot of our patients to be able to contract the pelvic floor. We also want to think about the direction of the contraction. So plenty of times I will give that cue, and I'm single glove finger intravaginal, so I'm feeling what's happening.
Sure.
And she might push down. That's another way to contract your muscles.
Sure.
But if you're not well connected or you just went through trauma, you might bear down instead. So having said that, if you want to contract your pelvic floor, you might also want to think about lifting those tissues off of the bike seat. So think about contracting up towards your heart.
Sure.
That direction has been important. Does that make sense?
Absolutely. No, for sure. And then tell me how, because you mentioned a lot of intervention during your birth. And how many kids do you have? Two. 12 and?
5.
Oh, I have a 6-year-old, yeah.
I know.
Okay.
Kindergarten.
Yes. Oh, whole nother
podcast, people.
Podcast, support group, all the things. How can you help moms maybe foster more for those that do want to have less intervention, possibly home birth, possibly a natural birth to where there's less intervention? How can physical therapy work, or working with a physical therapist like you?
Oh, I love that question. Yeah.
Yes.
Okay. So how can physical therapy support a mom who wants to have less intervention during her birth? Okay. So there's a couple layers to this. One, I would say, is education. And so for these women that we serve, when they have expert eyes, expert hands, expert ears, understanding what's going on with her body specifically, that is powerful.
Sure.
So for me to be able to say, listen, looking at you, I can see that you grip your shoulders and your baby's high. And so I would love for you to bring your attention, your awareness, some softening to your lower belly. Sure. Let's get your hips mobile so we can allow it to come down. But just that act of being present with them and assessing their specific body, once we educate from that place, it's really powerful.
Yeah.
So that's my first thing. Aside from that, we really have seen so much come from mobilizing the pelvic bones. So there's ways that the pelvis has to move, and I have my baby here for anyone watching. I have a pelvic model, and so our babies need to get into the pelvis, and this is the pelvic inlet here, if you can see. So this ring at the base is the pelvic inlet, and then we call this space around here, which is where your pelvic floor connects.
Sure.
That's your pelvic outlet.
And baby has to come through there.
Baby has to come from the uterus, which is sitting just above the pelvis. They have to get into and then out. Okay, hopefully not face up. Hopefully they go in and sideways, and then they do a little twisty dance and they come out through there. So we do very specific pelvic mobilizations to get this pelvic inlet to open up. And you see how that space increases, baby can drop in.
Sure.
Then we make sure, because we are not there during delivery, not yet. A couple of our doctors are really interested in partnering with doulas or being a doula. Super cool.
Sure.
But we also do mobilizations to make sure that the pelvic outlet can open up. Just make sure it's as flexible as it can be.
Tell my listeners why that's so important.
Yes, ma'am.
Yes.
So, because we know that the baby takes a very predictable path out through the birth canal, and that bones have to participate in that dance. They just do.
Sure.
And so is there truly a way to test, say, women who are failure to progress or the baby just didn't come down? Is there truly a way to know with certainty that it was bony malalignment, poor movement? You can't. We can make a guess based off of what we see in front of us. But we know, I mean, we've put our hands on so many pelvises by now. I mean, I'm partnering with 18 amazing physical therapists across South Florida. We all concur that when she gets closer to delivery, the degree of mobility at this pelvis is very different.
Gotcha. So although you can't maybe determine if there would have made a difference, you can determine all the ones you did that you're like, wait, they saw, I would imagine, greater statistics that, again, the less intervention, less tearing, I would imagine.
Yes. Yeah. We actually do have good evidence to support that physical therapy intervention, and specifically with the massage that we do, the releases that we do, that it will decrease the rate of tearing by 1 degree.
Wow.
Which, I mean, like, raise your hand if you would like to tear less. Yes, please.
Yes. And actually, you have 3 vaginas here.
Yes.
So explain the importance of them and why it's so important. Actually, and the visuals are key. So for those listening, you can definitely watch this on YouTube. But I love that because I think seeing the baby go through it, it's even more like, oh, no wonder why you would need more flexibility and to really get your pelvic floor, because it's so important in having that baby come out. Yeah. So you would want to have as much therapy to soften it, to relax it, to do all to strengthen it, to do all the things for that to come through there. Like visually seeing it, I was like, oh.
Yeah.
But again, we're not educated before we have babies that this is a thing, that this is important. Because I would imagine if I saw that beforehand, I would be like, oh,
sure,
sign me up for whatever it takes to have that come through.
Whatever.
So talk about the 3 lovely vaginas here and the importance and the different aspects of them.
Yeah. Thank you for that. So these 3, they're actually vulvas.
Oh, vulvas,
so the face of the vaginal area is the vulva. I mean, we kind of have vaginas because there's like a tube back there.
Yeah.
So this is your intact vagina. So this has, at the base of the vaginal opening is your perineal space. So we call that tissue that's between the vaginal opening and the rectal opening, your perineal body. Traditionally, this is the space that tends to tear if we are going to tear. Now, the birth canal is tubular, circular.
Sure. Yeah.
You can tear at any spot. I've had a couple in different areas. So it's definitely potential. However, it's kind of like if you study marathon runners, the majority of them will pull an Achilles tendon. Okay. Some of them strain their necks, but this is
majority.
What we know.
Sure.
Yes. So I say that because the majority of our research on decreased tearing and intervention to prevent tearing is about massaging this little piece of tissue right here.
Really?
They just talk about releasing this tissue because this is what gets torn.
Before giving birth.
Correct. Before, and then they often do it, most hospital workers that I know and then midwives that I've spoken to, they do this massage during labor as well.
Interesting.
Keeping with that analogy, Nicole, if you're a marathon runner and you go to physical therapy, you say, hey, listen, I really want to run another marathon, but I always pull my Achilles and it messes up my game. Can you help me? No physical therapist is going to be like, yeah, lay down and let me massage your Achilles. Yes. The end. Sure. No, like we look at you from head to toe. Sure. Let me watch you run. Let me see if your hamstrings are tight. Are your hips rotated? Is your trunk weak?
Sure.
What is the whole picture and how can we support that? So,
got it.
With that example, with Painless Pregnancy, we not only massage and treat this area, we want it to be flexible, but with a single glove finger, we release the external pelvic floor, the first layer, which is that circular layer that we're most familiar with, the one that hurts when you get that intravaginal ultrasound.
Yes.
And then the deeper tissue layers. So we get all the way in there. We get those rectal muscles to relax. I mean, many women now are knowing that when it comes time to push, you want to push like you're going to poop. A lot of women feel like they need to poop.
Sure. But they
That's
don't know how to push the proper way, because there is a proper way or a way to breathe into it, right? No?
Sure,
Yes.
sure.
Yeah.
And we can talk about that more for sure. If you look at the deeper pelvic floor layers, they rest over the colon. So essentially, when that baby's head descends into the pelvic space, they're putting the same pressure on that terminal colon or the end of your intestines that your bowel movements do.
Hence
So
yeah.
that's a great sign. You're like, oh, I feel like I have to poop. Everyone in the room's like, we're having a baby. Come on in.
Because it's already there, because they know that's the feeling, which makes sense, because it's affecting, it's going through the process of what it needs to be, to go through.
Correct.
I wanted to ask, because to take this into more personal, so I was telling you before we jumped on that 6 years after my son, really last year, so maybe 5 years, I turned 40 last year, experienced, now I can't hold it as long. Now I'm experiencing more pain. I'm more bloated than I was before. So in my mind, I'm thinking, oh, chalk it up to age, it's hormones. But I think the tinkling after that really kind of hit me, because I've always heard old school stories. My mom, everyone's like, oh, that's what happened. So I didn't have that before. My question to you is, for anyone listening, is it something for me over time that went unchecked? And is this common for women to experience, and to not just push it off to like, oh, it just happened? So maybe, I guess in talking to me and those listening that might have experienced this as well, that you may think you might not see an immediate effect, right, of how it could have affected. But now here's, like I said, starting last year, so 5 years to now, 6 years later, I'm starting to see some things, right, that maybe I should have checked or I should have strengthened or whatever. So maybe to speak on that, because I'm sure there's someone listening that is maybe like, oh, well, it's normal. So talk about that and how it's not normal.
Yeah. I love that question. So it is confusing, right? When we collect data on large numbers and we can see that, upwards of 80% of women report some form of incontinence or urgency.
Yeah.
So that means pee comes out when you don't want it to.
Yes.
Or you feel like you have to rush to the bathroom
Yes.
to be successful.
That's me.
Yeah.
Yeah.
So both of those things can absolutely be summative. So we can start to experience those symptoms after the incident or the trauma or the problem-causing event, because it goes unchecked and because all of the consequences can head you down that path. So let's say, for example, urgency. We get in this situation where maybe your pelvic floor is weaker because you haven't been intentionally strengthening it, and it went through a delivery, and that deserves rehab, that deserves some attention. It didn't get it. Okay, so we're 5 years after a delivery. Your pelvic floor is becoming weaker because if you don't intentionally hypertrophy a muscle or bulk it up with strengthening, it's going to head in the other direction.
Just like your arm muscles, your leg muscles, all the muscles.
Absolutely. Yeah. I mean, we can really challenge ourselves to build up muscle for years. You lay down for a week, you're losing about 10% of your muscle mass.
Wow.
I mean, it is not a fair scale.
Sure.
But that is the truth of our physiology.
Yeah.
So your pelvic floor muscles are getting weaker. Then what we tend to do is we get into situations where we as moms, we need to empty our bladder for convenience. Okay, so I'm about to run to Target. I'm arguing with my 2-year-old about you got to sit on the potty, and I'm going to sit on the potty because, gosh, I really just don't want to take you to a public bathroom, please. I just don't. It's a mission.
Yes.
And we just get in and out of Target without visiting the bathroom. So we start emptying our bladder for convenience. We typically take our eyes off of our hydration. So if we're not drinking enough water, that concentrated urine can become a bladder irritant, and that just makes you a little more contracty, a little more like, urge, I got to go.
Yeah.
And so all of those components of taking our eyes off of strengthening, taking our eyes off of hydration, off of how often we're emptying, we are, whether we know it or not, giving our bladder signals. We're saying, hey, bladder, you can hold 80% capacity, but I'm empty at 25%. If I do that a couple days in a row, the bladder's like, okay, got it. So
it's almost like muscle memory.
Yes, 100%. It's like you can train your stomach, right?
Yes.
Hey, stomach, we don't eat until 11 a.m. You do that a couple days, the stomach's like, all right, I'm quiet until 11.
Oh, wow.
You don't feed me. I'm adjusted. I will be hungry at 11. Or if you say, hey, stomach, we got to eat every 2 hours. This is the latest research. We're eating every 2 hours, okay? Yeah. Initially, you're like, I'm not hungry. You will train your stomach to want to eat every 2 hours. The problem with the bladder, Nicole, is that when you train it to empty at 25% capacity, it will get angry if you go to 30 or 40, and it will start speaking louder. It's like, listen, you ignored me before. Now I'm pissed.
Wow.
Take me to the toilet.
Yes.
And it will start doing its thing.
Yeah.
And you will feel all of that happen to you.
Oh, a lot of loaded information, but so much great information. But I love the analogy of understanding what that entails. And truthfully, you were exactly speaking to me, because I think back, I'm like, I was active before, but then of course, to your point, moms don't take care of ourselves. We don't know the exercises to do. So actually, let's dive into that. What are some exercises that moms can do at home during pregnancy, if in tandem with maybe working with a physical therapist? Talk about the importance of that and little things that could have been done for someone like me, and it's not too late, but some things to kind of re-strengthen that.
Yeah, I love that question. So we had spoken earlier about good cues to contract your pelvic floor. One thing we find frequently, not always, but frequently, is a tight pelvic floor. Mm-hmm. So just like you might have a tendency to hold your shoulders up, or you might be like really tight in your jaw and you tend to hold a little tension there, you can hold tension in your pelvic floor. So one thing that's super important for all of us to assess is, can I relax my pelvic floor? So if you check into that space that touches a bike seat right now as you're listening to us, imagine you could release it. Like really give it permission and give it that instruction to relax or melt. And if you breathe down there, if you add an inhale to that space, it gives it an extra cue to expand. So for those listening, if you can relax your pelvic floor, then you sort of understand its true or ideal resting position. You want it to rest in a lengthened position. No muscle deserves to be contracted all day long.
Sure.
Once you know if you can relax that pelvic floor, then there's a few ways you can train it. One is just a basic contraction, a shortening contraction. That's the one we talked about before. Pull up and in like you're trying to not pass gas. Zip forward like you're trying to not pass urine. You can also think that you're drinking a smoothie with your vagina, or picking up a blueberry with your vagina, like all these magic tricks that you can do with your private parts. So there's a basic contraction. There is endurance contractions. So let's say for a mom who's dealing with urgency, we tend to focus on pull up and in, maybe start at 30%. There's so many different ways you can tweak it, right? So, but let's say, okay, pull up and in, but only hold it at 30%. Keep breathing and see if you can count to 10.
Oh, wow.
While you hold it at 30%. And you might be quivering by 7 or 8 seconds. Like, it's like, holy cow. Then it kind of is that aha moment where you're like, okay, that makes sense.
Sure.
Maybe that's why I'm emptying at 30%, because that's like bench pressing 200 pounds. Like, who can do that for how many reps?
Sure.
So it's just about setting you up for success with whatever your issue is. Then the third way we practice strengthening the pelvic floor is what's called quick flicks, or that's your power. So those are your jumps with your pelvic floor.
Okay.
So that's a little tricky because we want to make sure that you start at the basement. So that means you start in a relaxed, lengthened state. You squeeze up and in, up, and then completely relax again. So it's fast and strong, and we want to make sure the basement gets hit from the beginning. We jump, and then we land back there.
Is this similar to like when you're talking, and we're going to get into sexual health with women, because I know that's something that's also passionate when you had mentioned, to discuss, but is it like a plank almost? I mean, I think of when I'm holding a plank, right? And holding my core is so weak. Is it two combined? Is there something with the core? Because it's funny, I haven't heard you mention core. It's all inside. So I would imagine that's very intentional, because does it have something to do with it, or does it not? Like, explain the relation between like the core and as if you're doing a plank. Talk about that briefly before we go into women's sexual health and how, having the pelvic floor and physical therapy can help with a woman's sexual health after baby.
I love that. Yeah, thank you. So the core and the pelvic floor, so specifically your abdominal wall, are sisters. They are deeply connected.
Okay, so they are connected.
Yeah.
Yes.
So if you put your fingers, so you know those bony parts in the front of your hips?
Mm-hmm.
If you sink your fingers just inside, so either side of your belly button,
Okay.
and you cough, you have a powerful cough, you should feel your deep core muscles pop into your fingers. Okay. Your pelvic floor should also contract. If it doesn't, then the pressure from your cough, instead of all coming out through here, might go down south. And that's why some of us might leak, or you might pass a little gas
Disconnected.
when you cough. Yeah.
Wow.
Yep. And if you look at your boy's stomach when he coughs, you'll see it. You'll see it go in strong.
Well, because they have their cores are
They're perfect.
they're perfect.
Everything about them is perfect.
But oh my God, that makes the visual is so true. Is that and I don't want to get too much into it, but is that how then a diastasis recti can come because it's disconnected, and why some women can be bloated and have bigger stomachs?
That's a great question.
Is that correlation?
So, diastasis will come when that tissue
Diastasis.
between your six-pack muscles stretches too much. Just that tissue just takes the brunt of the expansion of the belly space when we're pregnant.
Oh wow.
I mean, men can get it too if they get their
Sure.
dad bod and their belly is
Sure.
big. They can get a diastasis. Both of my kids were born with a diastasis.
Really?
Yeah,
So babies
pediatric
too.
population
Oh,
gets them too.
wow.
Yep.
Okay.
And my son still has it. I watched him the other day. He was doing sit-ups. He's so dang cute. And I was like, oh, it's still there. Interesting.
Okay. So it's common, but
It
there's
is,
a
yep.
Okay.
Yeah. Is there a correlation? Yes, for sure. So diastasis is correlated with low back pain, with bloat, with pelvic floor issues. Diastasis itself is not a painful condition.
No.
It should not hurt, but it can cause all those other problems.
Okay, before we part ways here, you've given so much amazing information and very high level and very practical and very like visual to understand it. Good. How can all of this affect our sexual health and women's health in regards to having sex with their partner or after having baby? Maybe talk about the effects of physical therapy with that before then you can say how everyone can connect and work with you.
I love it. Thank you. So yeah, this could totally be an entire podcast on itself. Maybe it will one day.
Yes.
But truly there are so many psychosocial and physical factors to why intercourse or any kind of sexual encounters post-baby during pregnancy are just different. So a bird's eye view of the physical changes that we go through during pregnancy, and if we are breastfeeding specifically or lactating in any way, our hormones, one, they shift a ton, but two, in certain phases can mimic menopause.
Oh, really?
Yeah. Yep.
Interesting.
So we're in a state where our hormones are telling our entire body to not reproduce. So we're getting signals of like, just focus on the baby in front of you and don't make another one.
Yeah.
Largely speaking, that is the state that we're in. So we can experience vaginal dryness. We can experience vulvar atrophy. We will just in general not have a drive too much.
The low libido, yeah.
Absolutely. The other things that we've seen in our practice is pelvic floor, like just dysfunction. So if you had your baby and your pelvis went whoop at the end and whoop and the tailbone came way out, I mean, your pelvic floor is on a massive stretch.
Sure.
There's actually a physiological response when a muscle gets really stretched and then it snaps back. It can stay in a frozen or tight space. So we've seen where the bones are just frozen out and the bones haven't been given any reason to come back in.
Sure.
We've seen where the muscles become really tight. And moms are like, seriously? Like, my vagina just got stretched maximally. And you're telling me I'm tight? Sure.
Yeah.
And I mean, we could write a novel on scar tissue.
Yeah.
So when we do tear, and let's say like this model here is torn, has a 4th degree tear. So we actually get tearing not only through the rectum, but its mucosal layer. So like up in that sphincteric muscle. There's a very specific way that your doctor or midwife will sew you up, typically from the inside out. And there's just a lot of scar tissue. So this space that when we become sexually aroused should have more blood flow, should get thicker and softer, or like plump, you would say. It's similar to an erection.
Sure.
And so it should be pliable to allow anything to penetrate. And oftentimes it's not. Yeah. It's not the same kind of hydrated, healthy tissue. It's rigid.
Sure.
Stronger than normal tissue, which is great normally. But in this space, we don't want you to be thick and
Sure.
tight. Yeah. And then I can just touch briefly on C-section.
Well, it's so funny because as you were talking, oh my goodness, and this is vaginal. We didn't even discuss C-section. So if you could do it in like a 2-minute thing, knock it out. Yes.
So basically when we have a C-section, our abdomen is cut all the way through to our uterus. A non-pregnant uterus sits really low. So one, it's a unique incision because the cut happens when we are 9 months pregnant, like massive.
Sure.
Cut open, sewn up, and then that scar immediately starts to get smaller and smaller and smaller because our bellies shrink.
Sure.
So it's a deep cut, and that cut goes through a lot of changes pretty quickly. That uterus, which has scar tissue through, it can bear down. So when we have intercourse, a couple things that are supposed to happen don't really happen. One of them is vaginal tenting. A lot of people don't know about this, but in a healthy vaginal space, when we get aroused, there's this tenting is actually a great word. It lifts the vaginal cavity. This space gets swollen and more open and lubricated, and so then penetration is easy. But if we don't have this lift up, then the cervix, the uterus can stay low, and then we can not only have issues with penetration, but also with the deep thrusting component, feels like he's hitting something.
Wow.
Yeah, so that's a thing.
Oh my God. Yeah. In my mind, I'm like, oh, I want to continue because it just so many things. And it's amazing that after having baby, it's like, okay, 6 weeks and you can have a child, where we haven't even discussed the mental, the physical aspects. And you just went through in, a 2-minute time of all the different things that can affect after having a baby. And it's like, oh, just have sex in 6 weeks. That's a whole nother thing.
Yeah.
But thank you so much, Kathleen, for coming on and sharing so much awesome information. Please share with my listeners how they can connect with you, they can work with you. I know you're in the South Florida area. Share all those wonderful things.
Awesome. Thank you for your kind words. I love being here. I really appreciate your time and what you do for our mom community.
No, thank you.
Is essential. So thank you for that.
Yes.
Yeah, so I'm Painless Pregnancy on all platforms. Instagram is where we spend the most time. We're also on YouTube and Facebook.
Okay.
And yeah, we are in-home concierge. So we go to patients' homes. We take excellent care of the moms that want to work with us. And we really just value their trust and being vulnerable and letting us take care of them as a whole person.
I love that. And before we part ways, I always ask my guests to leave with a final word. So anything that if someone listened to this conversation to say, okay, if all the things you got out of it, do X, Y, Z. So I'll give you the floor to kind of,
I would say my final advice would be to connect to your body. And so pelvic floor can be a really good place to start.
Yeah.
Excuse me. But in general, your body is here to serve you. You should enjoy it through your whole journey. So stay connected.
I love that because I think after kids, it's the first thing that we let go of because we're so into keeping our little one alive if we're breastfeeding and all the things. So going back, I wish I would have told myself 6 years ago. And I thought I was educated, right? It's like we even think that we are and we're not. So thank you so much for coming on, for sharing, like I said, such wonderful information. And continued blessings to you for love and light. Thank you.
Thank you.